Welcome to Gastro-oesophageal Reflux Disease, or GORD. Today we'll talk about symptoms, risk factors, and complications of GORD. Typically, one gets heartburn or regurgitation. When the acid rises from the stomach into the esophagus, it causes a burning sensation on the lower part of the chest or upper part of the abdomen, and this is referred to as heartburn. If the acid continues to rise higher up into the esophagus, sometimes all the way to the throat, especially when lying down, bending over, or doing some strenuous exercises, it can cause regurgitation. It can also cause atypical symptoms such as dental caries, hoarseness of voice, throat infections, shortness of breath from lung infections, difficulty or painful swallowing. So what causes reflux? Some conditions such as obesity, smoking, excessive consumption of alcohol, hiatus hernia, or certain conditions that decrease the motility of the stomach such as diabetes, and certain food products such as fizzy or carbonated drinks, spicy food, caffeine, and chocolates are some that cause reflux. Now, reflux can cause problems. It can cause complications. Most commonly, it causes inflammation of the esophagus, but it can also cause bleeding or narrowing known as stricture of the esophagus. If this continues for a prolonged period of time, especially years, it can cause a condition called Barrett's esophagus, which is a precursor for esophageal cancer or esophageal cancer itself. So thank you for listening. Next time, we'll talk about when to seek surgical help.